What if one of the biggest health mistakes seniors make isn't skipping a medical test, but agreeing to one without asking enough questions? Most people assume that more testing automatically means better health. It sounds logical. After all, if doctors can find problems earlier, shouldn't that always be a good thing? Not necessarily. Once you reach your 70s, healthcare changes. The goals change. The risks change. And sometimes, the very tests that were helpful at age 50 can create unnecessary stress, confusion, and even harm at age 70 or beyond. Now, before we go any further, this is not about avoiding doctors. It is not about ignoring symptoms. And it is definitely not about refusing medical care. It's about becoming a smarter patient. Because over the years, many seniors have gone through tests that led to alarming results, additional scans, invasive procedures, sleepless nights, and anxiety, only to discover that the original finding would never have caused a serious problem in the first place. Think about that. A test meant to bring peace of mind can sometimes create months of worry. Today, we're going to discuss 5 medical checkups and screenings that many experts believe seniors over 70 should carefully evaluate before automatically saying yes. And the final one may surprise you because millions of older adults undergo it every year without realizing the important questions they should ask first. Let's begin. One of the most important concepts in senior health is something called overdiagnosis. Overdiagnosis happens when a test finds an abnormality that technically exists but would never have caused symptoms, disability, or death during a person's lifetime. In other words, the test finds something real, but not necessarily something dangerous. The problem is that once something is found, it becomes very difficult to ignore. Doctors order more tests, specialists become involved, additional scans are scheduled, procedures are recommended, and before long, a person who felt perfectly healthy is suddenly caught in a cycle of appointments and worry. This doesn't mean testing is bad, far from it. Many tests save lives every day. The key is understanding when the benefits clearly outweigh the risks and when the situation becomes more complicated. The first type of screening worth discussing is the full body scan. Many private clinics advertise full body CT scans as a way to detect hidden disease before symptoms appear. The marketing sounds appealing. Who wouldn't want to discover a problem early? The challenge is that these scans often uncover what doctors call incidental findings. These are small abnormalities that may never cause harm. Tiny lung nodules, small cysts, benign growths, minor changes related to aging. Once discovered, these findings frequently lead to additional imaging, biopsies, follow-up visits, and considerable anxiety. Many seniors spend months worrying about something that ultimately turns out to be harmless. Meanwhile, the scan itself exposes the body to radiation. For some people, the benefits may outweigh the risks, particularly when there are symptoms or significant risk factors. But for otherwise healthy adults with no symptoms, routine full-body scanning deserves careful discussion before proceeding. The next medical checkup many seniors should think carefully about is routine cardiac stress testing when there are no symptoms. Heart disease remains one of the leading health concerns in older adults. Because of this, many people assume regular stress tests should automatically become part of aging. But that's not always the case. If someone is experiencing chest pain, shortness of breath, dizziness, or other concerning symptoms, a stress test can provide valuable information. However, in people who feel well and have no symptoms, routine testing may sometimes uncover borderline findings that trigger a cascade of additional procedures. The result? More testing, more uncertainty, and sometimes interventions that may not significantly improve outcomes. The most important factor is not age alone. It's whether symptoms, medical history, and overall risk profile suggest the test is truly needed. A good physician considers the entire person, not just a number on a birth certificate. Now let's talk about cancer screening. This is one of the most sensitive topics in medicine. Everyone wants to prevent cancer. Everyone wants early detection. And in many situations, screening absolutely saves lives. But after age 70, the conversation becomes more individualized. Why? Because different cancers behave differently. Life expectancy matters. Overall health matters. And the potential risks of screening become more significant. For example, Some screenings can lead to false positives. A false positive occurs when a test suggests cancer may be present even though it isn't. That single result can trigger biopsies, surgeries, and months of emotional distress. Some cancers also grow so slowly that they would never cause symptoms during a person's natural lifespan. Yet once detected, treatment often follows. This creates a difficult balance. Doctors and patients must consider not only the possibility of finding disease, but also whether finding it will meaningfully improve quality or length of life. The best approach is personalized decision-making. There is no one-size-fits-all answer. A healthy, active 70-year-old may benefit from certain screenings. Another person with serious medical conditions may reach a different conclusion. The key is asking informed questions rather than assuming every screening recommendation applies equally to everyone. Next, let's discuss repeat imaging. Many seniors undergo repeated CT scans, MRIs, or other imaging studies for conditions that are stable and unchanged. Sometimes these tests are absolutely necessary, but in other situations, repeated imaging provides little new information. A common scenario occurs when a small abnormality is discovered. The finding may be harmless. Nevertheless, follow-up scans continue year after year. Eventually, patients begin to wonder whether the testing is still necessary. This is a reasonable question. Every medical test should have a clear purpose. The goal should not simply be to repeat a test, because it has always been done that way. Instead, patients should ask, what specific information are we expecting this scan to provide? How will the results affect treatment decisions? What happens if we choose not to repeat the imaging? These conversations help ensure that testing remains focused on meaningful health outcomes rather than habit. Now we come to a topic that surprises many older adults. Routine laboratory testing. At first glance, blood work seems harmless. A quick needle stick, a few numbers on a report. No big deal. But laboratory testing can sometimes create unexpected challenges. The more tests performed, the greater the chance of finding minor abnormalities. Many of these values fluctuate naturally. Others fall slightly outside the reference range despite having little clinical significance. Yet seeing an abnormal result often leads to additional testing. This can create worry even when nothing serious is wrong. A slightly elevated value becomes another appointment. Another appointment leads to another test. And another test leads to another question. Before long, the original issue may have been nothing more than normal biological variation. Again, this does not mean blood tests are bad. Many are extremely valuable. The lesson is that testing should be purposeful. Every test should answer an important question. Every result should have a plan. One of the greatest misconceptions in healthcare is the belief that doing more always means doing better. In reality, excellent medicine often involves knowing when not to test, knowing when observation is appropriate, knowing when a symptom requires immediate investigation, and knowing when a finding is unlikely to change the course of a person's life. This is especially important after age 70 because quality of life becomes a central goal. Imagine two different seniors. The first spends every month undergoing tests, appointments, procedures, and follow-up visits despite feeling well. The second focuses on exercise, sleep, nutrition, social connection, mobility, and managing meaningful health risks. Which person is more likely to enjoy their later years? The answer isn't always obvious. Medical care matters, but lifestyle remains extraordinarily powerful. Regular movement helps preserve muscle mass. Strength training supports balance and independence. Good nutrition fuels recovery and immune function. Social engagement protects emotional and cognitive health. Quality sleep improves nearly every system in the body. These factors often provide benefits that no scan or blood test can replace. As people age, healthcare should become increasingly personalized. The right question is not, what tests should everyone over 70 get? The better question is, what tests make sense for me based on my health, goals, symptoms, and medical history? That shift in thinking changes everything. It transforms patients from passive participants into active partners. It encourages meaningful conversations with healthcare providers, and it helps ensure that every test serves a clear purpose. Before agreeing to any screening, imaging study, or procedure, consider asking 3 simple questions. First, How will this test change my treatment? Second, what are the risks and benefits? Third, what happens if I decide not to do the test right now? These questions often reveal whether a recommendation is essential, optional, or somewhere in between. The most informed patients are not the ones who refuse testing. They are the ones who understand why testing is being recommended. Knowledge reduces fear, understanding improves decision-making, and better decisions often lead to better outcomes. Aging is not about chasing every possible diagnosis. It is about protecting independence, preserving quality of life, and focusing on what truly matters. The goal isn't to avoid medical care. The goal is to receive the right care, the right test, at the right time, for the right reason. Because after 70, health is no longer measured simply by how many tests you've had. It's measured by how well you're living, how strongly you're functioning, and how confidently you're making decisions about your future. And sometimes the most powerful thing a patient can do is pause for a moment and ask one simple question. Do I really need this test? That single question could save time, stress, unnecessary procedures, and perhaps even protect the quality of life you've worked so hard to build.